Good morning, sisters and brothers in Christ. It is indeed a privilege to be here once again. I'm so happy to be here again. And as I walked in, I felt 10 years ago was the last time I was here, and I felt as if I am one of you who has gone out into the field overseas to do the work of the Lord and is now back with such a welcome that I feel very happy. And you know, the Jamaican thing, when one of us go away for some time and we return, our families and friends are expecting. And so I was not surprised any at all when Christine from above has thrown out the advice that seeing this is like a homecoming for us, we should now contribute, right? The usual expectancy. But on a different note, and I will forego what I have prepared. 10 years ago, I stood in this podium and I spoke about the whole concept of Women's Health Network and our mission. I remember speaking about the importance of physical health, psychological health, emotional health, but also spiritual health. And even if we have physical health and we do not have the other health, especially spiritual health, the health of kindness, love, gratitude, forgiveness, those sort of fruits, our physical health will not shine through as the Lord meant it to be. But brothers and sisters in Christ, I am here to report that over the last 10 years, we have touched the lives of many Jamaicans. We have been in 5 parishes, in about 11 communities, and we have contributed over 50 million Jamaican dollars each year in social value to communities. And this year, we have brought something that Jamaica was waiting for. We have been able to bring Jamaica in line with developed countries by, for the first time at last, albeit a very soft landing for us, we have conceptualized and we have, over the last week, we have done a National Women's Health Week. This was proclaimed by the Governor General on the 26th of April. So for the first time at last, we look forward this time of the year to celebrate the health of women. It will give us the opportunity to look within our communities as to what is and has been happening to women and how we can address many of the inequities that follow. And this month, being Child Month, it's a very good month to have it so that we can reflect. Because if the woman is not healthy and she becomes pregnant, the likelihood of a healthy child is not possible. And if the woman is not healthy, the woman cannot parent effectively the child. And hence the problems or the social problems that we have in society. And this week, our theme is women. When women are healthy, families and communities thrive. I will repeat for you to remember, because I want all of you to leave today remembering that. If the woman in the house is not well, it is unlikely that the family will be taken care of in the way that it ought to be. And I am very pleased and grateful that for this week of celebration, the Medical Association of Jamaica, the Nurses Association of Jamaica, the Family Planning Association of Jamaica, and the Association of General Practitioners of Jamaica partnered with us and collaborated so that the week would become a reality. And therefore, we are looking forward every year at this time. We were not fortunate in getting a lot of the advertisement that we need, but we are hoping that as the year goes by, we will get more and more persons come on board, and that women will be aware of the preventive checks that they need to be done to maintain their health. And I say to you, if you are driving a car every day, it needs some form of maintenance. The oil needs to change. The tire needs to be checked. And therefore, we are encouraging women to give yourself a checkup during this time of the year. Go and do at least one preventive checks, and we have published them already. And by the time you reach my age, you will be looking as good as I, and you're feeling as healthy as I am. I thank you very much, and thank you for your support.